Does eating a ketogenic diet harm your kidneys? In short, no. There's no quality data to suggest this is the case. In fact, there's mounting data demonstrating the opposite, that keto diets are neutral or even beneficial to kidney health. So why is there controversy around this topic, and what do we all, including healthcare professionals, need to know to clear up the confusion? Let's get into the details. Welcome to Metabolic Mind, a nonprofit initiative of Debunking Group, transforming the study and treatment of mental disorders by exploring the connection between metabolism and brain health. Thank you for joining us on this journey. As I mentioned, there's mounting evidence that ketogenic diets can be neutral or even beneficial to kidney health, which goes against many popular online posts concerned about the opposite. But before we get into the details, please remember our channel is for informational purposes only. We're not providing individual or group medical or healthcare advice or establishing a provider-patient relationship. Many of the interventions we discuss can have potentially dangerous effects if done without proper supervision, so consult your healthcare provider before changing your lifestyle or medications. In addition, please recognize that people may respond differently to ketosis, and there isn't one recognized universal response. The most commonly voiced concern about keto and kidney function is the assumption that keto diets are by definition high-protein diets. And there's concern that high protein is inherently harmful for kidney health. So the first point of clarification is that most keto diets are not high protein, but rather adequate protein in the range of 1.0 to 1.6 grams per kilo of reference body weight. That makes keto a moderate or adequate protein diet and by no means a high protein diet. You can watch our video on how much protein you should eat on ketogenic therapy for more details about this. But the key is that when we look at the RDA, or recommended daily allowance for protein, that's a low protein diet. It's the minimum to prevent protein deficiency in an average individual. So eating more than the RDA does not mean it's a high protein diet, and that's crucial to clear up. But here's another important point. There's actually no evidence that protein is harmful to kidney health for everyone who doesn't have severe kidney disease, meaning anyone who's not close to being on dialysis. And even then, there's some disagreement, but clearly with what's called stage 1 to stage 3 or mild to moderate kidney disease, there's no quality evidence that protein is harmful. In fact, eating more protein may help people with kidney disease live longer. So here's a study published in JAMA, August of 2024, titled Protein Intake and Mortality in Older Adults with Chronic Kidney Disease. This was an observational study following patients with stage 1 to 3 kidney disease, again in that mild to moderate range, and followed them for 10 years. And they found those eating more protein lived longer. Exactly the opposite of what we would expect if protein was harmful for kidney and overall health. Now, as with most observational studies, this doesn't prove higher protein intake causes people to live longer, but it certainly raises questions about the harms of protein, seeing how they lived longer in this study. And that makes sense, right? I mean, protein is beneficial for lean muscle mass, for muscle strength, and metabolic health. Anything that improves metabolic health and prevents frailty is likely a net benefit. And that brings us to other evidence about a keto diet potentially being beneficial for kidney health. Dr. David Unwin published data from an audit of his practice demonstrating that his patients improved their kidney health after starting ketogenic therapy. And again, this makes sense since metabolic dysfunction and diabetes and high blood pressure all worsen kidney function. Improving these dangerous conditions should improve kidney function. And that's exactly what Dr. Unwin found with ketogenic therapy. And there's yet another study, this one from Dr. Thomas Weems and colleagues, who published a couple papers regarding their randomized controlled trial of patients with polycystic kidney disease, so a specific genetic disorder leading to early kidney failure, who were treated with a ketogenic diet. And he found improved kidney function for those using ketogenic therapy. And one analysis demonstrated even more impressive results for those who are most adherent to the diet, with beta-hydroxybutyrate levels above 0.5 millimoles per liter more than 75% of the time. And we will also link in the description below to a meta-analysis looking at 12 trials demonstrating no harm from keto, and a review article that goes into even more detail about the studies demonstrating a neutral or beneficial effect of ketosis on kidney function, and it addresses some of the other concerns like acid-base status and so-called hyperfiltration and protein spilling in the urine, and how clinically these aren't concerns with ketosis. So the bottom line is that it appears it's time to put this fallacy to rest and realize that there is no reliable evidence implicating ketosis as harmful to kidney health. In fact, we need to consider the opposite to be true, that ketogenic therapy may improve kidney function given its beneficial effects on metabolic health and risk factors for kidney disease. As for those with advanced kidney disease nearing the need for dialysis, an individualized approach needs to be taken with one's healthcare team, as the data for ketosis simply don't exist one way or the other in this population. But if you hear that you shouldn't start ketogenic therapy or eat a ketogenic diet because it's bad for your kidneys, please share this videos and the resources in the description so we can promote a better understanding of this very important topic. If you found this video helpful, please like and subscribe, and please share it with anyone who you think may benefit. And please leave a comment, as we'd love to hear about your experience with ketogenic therapy. Thank you for watching. I'm Dr. Bret Scher, and we'll see you here next time at Metabolic Mind, a nonprofit initiative of Bazooki Group.